Good evening, everyone. I welcome everyone on-site and online to the Satellite Symposium, a transformational approach to managing allergies to cat, organized by Nestlé Purina Institute. Allow me to start with one of my favorite books, which is Animal Farm by George Orwell. And you may remember a very famous quote from this book: all animals are equal, but some animals are more equal than others. And let me paraphrase it by saying, all cats are equal, but some cats are more equal than others. And this is very true for cat owners, especially if themselves or the members of the families are suffering from cat allergy and they wish to keep their cat at home. My name is Hania Szajewska. I'm professor and chair of the Department of Pediatrics at the Medical University of Warsaw, and it will be my privilege to chair this session. The main objectives of this symposium focus on discussing the burden of cat allergy, classical care pathways in the management of cat allergy based on cat avoidance, and an innovative approach making it possible to keep a cat in the house of allergic patients. The symposium will have a kind of format of the discussion. Also, everyone who is contributing, participating in this session online can ask questions. And we will have two excellent speakers, and allow me to introduce those speakers to you. First is Professor Antonella Muraro. Professor Antonella Muraro is professor of food allergy at the University of Padua and consultant in allergies at the pediatric department of the University Hospital of Padua. And of course, for all members of EAACI, she is very well known as the past EAACI president, previously also holding many other positions in EAACI and still being very active in EAACI. Antonella, it's a pleasure to have you with you.
Thank you.
And the second speaker is Ebenezer Satyarai, with PhD in immunology and director molecular nutrition, Nestlé Purina Research in St. Louis. And Dr. Satyarai has authored numerous scientific papers in the area of cellular molecular immunology and cytokine biology, and also some of the papers which are related to the topic of today's presentation. So, okay, once again, please remember the audience on the line and on site. You can always ask the questions, and we will try to answer the questions at the end of the symposium. So after introducing the speakers, allow me to start with, and I think we can start with some questions. I know, Antonella, that you are seeing patients with cat allergy. Yeah. So can you just present us one of such patients? I think it will be of interest to everyone.
Actually, in my daily practice, I see many patients with cat allergy. And it is quite surprising for me that what is common sense for the allergist is an insane advice for the cat owners, even with allergy. So I would like to start with the clinical scenario.
Excellent.
So, if you can show me, I had some slides. Okay, thank you very much. So for the audience at home. So this is a scenario of a 6-year-old boy suffering from recurrent wheezing, and to the worsening of symptoms, especially during nighttime, the pediatrician recommended an allergist evaluation. And when he came to our office, skin prick test with inhalant allergen were highly positive to cat, and spirometry was still normal. So the family has actually an 8-year-old cat that has been the mother's cat before she got married. So,
okay, that sounds very difficult. So can you tell us a little bit how big is a cat allergy problem before we go into the discussing the case?
It is the prevalence is increasing, and it is currently the most common animal origin allergy across the world. And as many as 1 in 5 adults suffer from sensitivity to cat and cat allergies.
Okay, now I have a question to you. Can you explain us what causes cat allergy?
As compared to, let me just go to the slide. As compared to what people normally think of as the hair being the source of the allergen, surprisingly, it's a protein that is secreted in the saliva. There are over 10 proteins or allergens that cats produce, but the most important one is the protein called FeLD1. And there are certain features about this protein that's unique. It's primarily secreted in the saliva and sebaceous glands. It's a protein that gets attached to the hair of the cat during the grooming behavior that cats exhibit, and then travels as these cats groom. These saliva on the hair dries and forms dander and gets into the environment, and we'll talk a little bit about that later. Covered a little bit about what the allergen is. An important point that I'd like to make here is there is perception in even if you Google and search for information around this, that there are certain breeds of cats that are known to be non-allergic or low allergic. That is a myth. All cats produced some level of allergens, and that's something that is important for us to be able to understand and recognize as we work with some of these challenges with cat allergies.
Okay, so there are no hypoallergenic cats. We can summarize it in this way.
That
okay,
is correct.
perfect. Antonella, another question for you. What are the current recommendations for managing or treating cats' allergy? And what is the evidence base to support those recommendations? Can you comment on it, please?
Yes, we have a difficulty in setting evidence-based recommendation. The last consensus dates back 2018. It was very well done with evidence based on the level of scientific evidence. Nevertheless, it is a consensus expert due to the low level of evidence. However, the expert says that relinquishment and avoidance of the cat are the main measures. And then you can move on to reduce the exposure and to try to combine some measures to or immunomodulate with immunotherapy the patient in order to provide some relief instead of increasing medication. So overall it is a burden. This is the consensus I mentioned before, and this is the level of evidence that you can see here. It is very low level. If you can, for the audience at home online, or the office at home online, but I hope not at this hour. The level 4C, 4D means that we don't have enough evidence, and it is based mostly on the recommendation of the experts. So the main recommendation are remove the cat in order to reduce the likelihood of asthma exacerbation, and then try to start the intervention as soon as possible, as this can undermine the possibility of resolution of the cat allergy, most important, the symptoms. In Marcus' scenario, as I would like to get back to that, the allergist perspective is to have a diagnosed moderate asthma. We prescribe a combined therapy with inhaler steroids and long-acting bronchodilators for the asthma, and recommended avoidance and relinquishment of the cat. And the family perspective was extremely the opposite. They were surprised by the recommendation. The mother said, in 2020, this is not possible that you haven't found the cure. Okay, mother didn't want to give up the cat after 8 years. He is a family.
All cats are equal,
he's a family member.
Some are more equal than others. I am repeating it. All cats are equal, but some cats are more equal than others. Okay.
Altogether, they requested some time to think about it and to get back to us. So, and they started, as Ebenezer said before, to perform the Google search on their own. So, actually, this is it's very difficult looking at the literature that a patient with asthma or other allergic rhinitis triggered by cat allergy relinquish their cat. It is more probable that relinquish their allergies. So in this study, most of the patients and families who had a cat didn't want to give up their cat. And then the family requested a compromise that they are not ready to relinquish a cat and asked for other measures. For example, they propose, can we isolate the cat to a room or small area in the house? I explained that the cat dander is everywhere, even for a long time when the cat is not anymore there. So can restrict the cat from Marcus' bedroom and common living areas. Again, same explanation. Can we put the cat outside only? Sorry, this is not possible. And the boy starts crying. And can we bath him frequently in order to remove allergens? This is something that can be a viable option. But and this is something that is a combined measure. Again, we have 5D, which is, again, expert's opinion. And then, if you see here, what you do when you are bathing often the cat, you can see that the mean FeLD1 levels comes back to the same level after some hours, 1 day from the cat bath, and then before and after, in the middle, you can see the cat dander spread in the house, and what is the mean airborne FeLD1 levels after and before. And it is a measure that can help for some hours, 1 day, but then we are again stuck. So FeLD1 is everywhere. And then hypoallergenic cat, so they start looking for hypoallergenic cat. I explained that there aren't hypoallergenic cat. They didn't believe to the doctor. They start inquiring around. And then they came up with a hypoallergenic cat from Egypt. And they said, can we buy this cat in Egypt and try to have it at home? And I replied that this breed of cat is not hypoallergenic either. It's completely different from our breeds, but it is still disseminating FeLD1. So,
once again, there are no hypoallergenic cats. This is very important information, and we already know what are the current evidence-based, even if the evidence is not very strong, but evidence-based guidelines. And now the approach that we are going to discuss in depth is based on preserving the human-cat bond. And would you be so kind as to tell us what is the cat's owner perspective?
Happy to do that. Since after having talked to Antonella, it was so apparent because prior to those interactions, even in the consumer work that we've done, one thing that really stood out was the relationship, the bond that people have with their pets, especially the cats. To again repeat your statement earlier, some animals, cats, are special. They are unique in the relationship they have with the pets. So what I have on the screen is a study that was done by the Purina Institute. It studies human-animal bond. And the question that was asked was, if your physician were to recommend that you have to give your cat away or remove the cat from the household because somebody in the household has a problem or an allergy, what would be your reaction? And just in keeping with what Antonella described, most of the people would keep the cat rather than give the cat away. If you look at the rate, only about 8 out of the people surveyed would give away the cat. Others would have a second opinion. People may even change their physician or allergist, but not give the cat away. And just to build on the comment that I made, people go through all kinds of chores, effort, cleaning routinely, changing to hardwood floors, trying to completely replace their upholstery and carpeting and curtains every so often to get rid of this allergen, which is highly sticky. It tends to stick and stay in the environment for a long time. So that is a challenge that we see, and it comes through in this study as well. So 84% of the people would keep the cat despite the physician's recommendation. So I think that really begs the question, do you have a different solution that you can come up with?
Okay, Antonella, so what is the current recommendation? What should be?
We have to find a way where the cat owner can choose to relinquish the cat, or having another option which is safe and affordable, and also safe for the cat as well. As bathing, for example, could be very dangerous for the cat every day. So the impact of some methods to reduce allergen exposure may cause stress for the cat owner and also for the cat itself. So we have to perform a frequent bathing. Frequent bathing means daily bathing, and the cat can decide to leave the house, as at the end it will suffer very much. And cat allergy, on the other side, is an important factor for cat owners to evaluate for relinquish the cat, as some decide with much sufferance to relinquish the cat. So allergy in household members were the most common cause for relinquish the cat, 5 times more than the others.
So can you comment on the cat's perspective?
So that's an important one, because as you look at people's reaction, there are challenges to relinquishing the cat, both from the human perspective as well as from the cat's perspective. The reason you have a pet in the household, especially if you have small children, the bond that they build with the pet, is because you want to enjoy and love that relationship. So having to restrict that relationship either by getting the cat away, or the earlier point that Antonella made about trying to restrict the cat to a particular part of the household, it's a huge challenge and a stressor for the human as well. Then, of course, the medication that people take to be able to manage their symptoms while having a cat in the household. The flip side of the coin is the challenge that cats experience. Now, many of you may think that cats are not the social animal. They're not like your dog that comes and falls on you as you come back from home. But they do enjoy that relationship. And trying to keep the cat away or enclosed in a particular environment can cause significant stress for the cat. And some of those things are listed here in terms of the impact of the people, reduced relationship quality, diminished attachment. There's a perception of lack of emotional support that many people depend on their pets. Become very apparent in these days when we've had COVID and many of us are homebound. We got so attached to our pets. So it brings that relationship and support that's lost. And then the stress on the cat can have significant impact on their health as well. So there are real tangible consequences both for the pet owner and the pet as they navigate through the challenges of having a cat and working through allergies that either they may have or somebody in the household.
Excellent. Thanks a lot. Antonella, again, going back to the current management, please comment.
So the current management is currently not so good, as we have avoidance, we have to control the symptoms, we have to control the environment, and then we have to consider how many of these measures are really effective. So we have, in the long term, to maintain recommendations. And this is a stress as well, as all the recommendations which are a burden by themselves should be maintained lifelong, the cat life, and even after, when the cat dies, as the cat dander, as said before, FeLD1 is everywhere. So there might be a role for FeLD1 for the cat.
And now I would like you to
pass
comment exactly on this
Exactly.
role of FeLD1.
So we touched a little bit about what the FeLD1 is, where it is produced, how it hangs around for the long time. Those are important things to keep in mind, and that there are no hypoallergenic cat. All cats produce FeLD1. Interestingly, if you study FeLD1, again, there are two perspectives. If you look at it from the human perspective, people have really chopped up the protein multiple ways and really defined what the epitopes are. This is in trying to develop immunotherapies. But the fundamental question of what does FeLD1 do for the cat remains unanswered. Nobody quite knows what it actually does for the cat. There are various theories, and some of those are listed here. For example, it's a pheromone. It has some role in epithelial defense, perhaps in lipid regulation, immune signaling. But no clear understanding remains. There's also some perception that the protein by itself has no real function for the cat. Now, all these put together raises a very important question. And the question is, how do you deal with a protein whose function is not clearly defined? You do not want to come up with a strategy that either prevents the production of the protein, suppresses the protein, or destroy the protein in any way, because it could have a significant role for the cat that is yet to be undiscovered. So that's one of the hallmarks of the approach that we'll be talking about, because that is central to what we do. We do not want to do anything that can have harm for the cat. Just like in the medical field, you do not want to you want to treat the patient, and no harm has to follow as part of the process.
But how does this approach work? Can you comment on this,
Let me walk you through the approach in the subsequent slide. So before I get into the details of the process, let me quickly introduce a new idea, a technology that's been around since the 1970s. And this is the unique way of generating antibodies in egg yolk. Just like in humans and mammals, when you immunize an individual, you produce antibodies, IgG antibodies, and they tend to remain in your circulation. But in avian, there is a unique way in which these antibodies get co-located or present in the egg yolk, and that's a way for the avian to transmit mammalian immunity to the, maternal immunity to the young ones, just like colostrum does that in mammals. So this is a technology that's been used quite successfully. It's safe, it's simple to be able to deliver antibodies directed against specific proteins through diet. And I just want you to keep that idea in mind, because that's going to be fundamental to the approach that we have taken.
Okay, but can you tell more about what kind of research has been done on this, please?
Absolutely. So let me begin by walking you through the journey that FeLD1 takes from the saliva onto the environment, which is where you actually see its effects. As I described earlier, the protein is released to the saliva. As these cats groom, it gets deposited onto the hair, and then it dries and forms what is called as dander, which is then released into the environment. And that is the dander that carries the allergen that people either respond to or are sensitized by. The approach that we're taking is very simple, and here is kind of a top-line view of what happens. You feed the cat a dye that contains antibodies that are directed against FeLD1. And these are antibodies that is made using the IgY technology that I described earlier. The antibody goes and binds to FeLD1 that is produced in the saliva. This FeLD1 is then released into the environment through the normal process that FeLD1 takes as cats groom. And this FeLD1 is unable to interact with the human machinery that elicit allergic symptoms. That is the fundamental hypothesis or the principle behind this innovation. Let me quickly walk you through a sequence of studies, again giving you a very top-line view of what was done, and there will be opportunities for you to ask questions. I want to go through 5 different kinds of studies that were done. Early preclinical studies that were in vitro and in vivo studies that were carried out to actually confirm whether our hypothesis had any scientific basis. Then before going into in vivo studies with cat, we wanted to be absolutely certain that the approach that we have taken is safe for the cat, and I'll give you examples of 2 studies. And then a very small human proof of concept, because at the end of the day, the approach has merit only if it matters for people who have sensitivities to cat. So let me quickly walk you through the series of studies. I'm just showing representative examples of multiple studies that were done to make the point for each of those elements. What you see here is an ex vivo experiment that really demonstrates that once you neutralize FeLD1 with antibodies raised against it, it prevents its ability to elicit an allergic response. In this, what you're looking at is degranulation activity as a representation of allergic response. So this is kind of a stand-in for the human in a petri dish, if you want to call it that. And what you see when you compare pre-immune egg, which does not have antibodies directed against FeLD1, versus post-immune egg, is that you're able to significantly reduce, in that case, almost 60%, the ability of FeLD1 to elicit an allergic response, in this case, degranulation. Clearly showing that the approach or the hypothesis has basis in terms of what happens with biology. Having done that, the first thing that we did was to be able to establish that this approach has no harm for the cat. And again, that's going back to the fundamental belief that we have that any approach we take should have no negative impact on the dog or the cat, just like you would do in medicine. And for this, we had a 6-month study where 40 cats were fed varying levels of FeLD1. We had a control group, and there were three other groups that were fed 1x, 5x, and close to 10x of the intended dose that we were planning for our in vivo studies. And there was a whole series of measurements that were done both from a clinical standpoint, body weight, food consumption, before and after the study. And when you pull all the data together, there was no significant difference between the control group and any of the diets that were fed, clearly showing that the diet had no significant negative impact, or no negative impact on the cats, establishing the safety of the approach. Now, just as a side note, many of the cats who were part of the study have been adopted by members of the R&D community at Purina, and they are wonderful cats, as you can imagine, special cats, as Hannah would call it. The next set of studies, then we moved into in-species studies. And the first thing we wanted to ask the question, does the approach reduce the amount of active FeLD1 that these cats would produce in the saliva? And for this, we had a control group and a test group. And when you measured the amount of reduction of the active FeLD1 in the oral cavity of these cats once they were on that, we were able to show a significant reduction in the amount of active FeLD1. By the way, the previous study on the safety and this study has also already been published, as well as the other studies down the road. And if you go to the Purina Institute website, you should be able to download those papers and go through the details. I'm really covering the top line here to make the point of the safety and the efficacy with regard to reduction of active FeLD1. I want to make an important point here again. We went back to the safety of the approach, where you do not want to interfere, destroy, or suppress the production of the protein. In this case, when I'm talking about neutralizing, you're binding it and preventing it from interacting with the human machinery. You're not destroying the protein. You're not reducing the amount of FeLD1 that these cats produced. After having measured it in the saliva, the next immediate question was, what happens in the hair? Because as we saw earlier, hair is the jumping point for the FeLD1 from the mouth into the environment. And this was a much larger study. We had over 105 cats as part of the study that were fed a controlled diet for 2 weeks to establish the baseline levels. And then they were measured weekly for a period of 10 weeks to see if their FeLD1 levels, active FeLD1 levels, decreased. And what was quite dramatic is after about 3 weeks of feeding, you could see a significant reduction that stayed almost until the end of the study, showing that the approach clearly reduces active FeLD1 on the hair of these cats. And if you extrapolate that, that would mean these cats are likely putting out less allergen into the environment. if you want to look at numbers, there was about 87% of the cats showed a 30% or greater reduction, and over 50% showed 50% or greater reduction. So significant amount of reduction in the amount of allergens that these cats are releasing into the environment. On average, we saw a 47% reduction in the amount of active FeLD1 in the hair, and it ranged from 33 to 71. Again, the important point being here is the diet is clearly able to reduce the amount of active allergen that these cats are likely to release into the environment.
Sounds perfect, but are there any human studies that you can share with us?
We have a small human study that was conducted with Dr. James Bednar, who's head of allergy and immunology at Washington University and Barnes Jewish in St. Louis. And I'll quickly walk you through that study. This was a small proof of concept study, double-blind crossover study, very small in the final set of subjects who went through the study, because we went through a lot of screening to be able to get to the numbers we needed. There was a priming exposure to high FeLD1 levels to kick their symptoms off, followed by exposure to bedding used by either cats that were on a test diet or cats that were on a controlled diet. And the symptoms were measured using their TNSS and TOSS. This audience is very familiar with that, every 15 minutes for 3 hours. And this was done in a controlled environmental chamber. The top line of the study was when you compare test diets to the priming diet as a point of reference, there was statistically significant reduction both in the nasal symptom scores, nasal congestion, scratchy eyes, itchy eyes. We did not see any reduction when you compare the control diet fed cat group to the priming exposure. Again, demonstrating that there is the likely benefit of this in terms of what people might see in terms of symptom reduction once these cats are on the diet for a certain number of weeks.
Yeah, Antonella, that sounds fascinating.
Yes.
Do you think this can really have an impact on the guidelines, on the management?
I think so, as we can summarize that we have in vitro and in vivo studies where anti-FeLD1 IgY binds and neutralizes the FeLD1. So again, neutralization can reduce the granulation, and this is the scientific basic mechanism. Mm-hmm. But we have some in vivo studies that this product, anti-FeLD1 IgY, is safe for cats, which is important as well for the owners, as this is the first question that I ask you. And then we can, a test diet coated with that didn't show any danger for the animal. And then we have the proof of concept study, which in adults with cat allergy showed efficacy. So we can move to have another option here. Instead of relinquishment and avoidance, we can start to reduce the allergen production by cat, feeding him with this product which contains, with the new food, which contains anti-FeLD1 IgY. So this will allow us to change completely the approach, as it is innovative, as the FeLD1 is linked, bound to the anti-FeLD IgY, and this is neutralized. In the environment, you have the neutralized allergen, which is not recognized anymore as an allergen. In the hair, the cat distributes the neutralized allergen. At the end of the day, this acknowledges for a reduction of symptoms. And this is something which is fundamental, as we don't know the real value of FD1, we cannot modify too much physiology. And at the end, having FD1 intact can preserve some unknown properties and, let's say, finalistic value for the cat. At the same time, it can decrease the symptoms, allowing the patient to keep the cat and to have a life which is almost symptom-free. So this allows us to reframe the conversation with our patient instead of having an endless negotiation on the several measures, starting with the relinquishment and then denial and then negotiating a combination of measures. We can try to have this, to implement this safe procedure, which is safe for the cat and safe for the owner. And also, this can be easily integrated in a comprehensive approach. So they can provide the bathing to the cat, maybe not daily, but twice a week, and then continuously feed the cat with the product with anti-IgY against the FeLD1. And so this may ultimately increase the patient receptivity and compliance, and also, let's say, the relationship of the trust in the relationship with their doctors, which is not trivial, as currently patients prefer to go to the internet instead of listening to the doctors. Now we are providing them with an option which is safe, effective, which address also their emotional life, which is not trivial, considering that loneliness has been demonstrated during COVID pandemic to be a very huge burden for everybody, including families with children.
So in real life, it will change the conversation, really change. It's likely to change your conversation with your patients, the one which we started to discuss.
To be honest, I have already started this process, and at least in my daily practice, it is rewarding. As when they start, attempting to negotiate, the common sense is avoid the cat and relinquish the cat. So they start, I know that I have to avoid the cat. I said, no, there is an option. And they smile. And they said, you are my doctor. But however, we know well that cat allergies is increasing in prevalence and affect as many as 1 out of 5 adults, and then can have a detrimental effect on psychosocial relationship. And FeLD1 is a major cat allergy, is produced by all cats, and this is important to be underlined. And this approach, which is safe for cat, neutralizes the FeLD1 for human beings, is a mean to reduce allergenic load for cat owner, and at the same time they do that doing something which is normal, which in normal life, that's feeding their cat. And I have a question for you. How many times they should feed the cat with the anti-IgY?
It's a great question. I think the approach that we've taken is to keep the feeding instruction with what you do with how you normally feed.
Okay.
And that, I think, is an important point that you bring up, Antonella, because as you look at consumer studies, the processes and instructions that are followed are the ones that are simple.
Okay.
When you start having complications, people follow them for some time, and then they give up. So if you're able to integrate it with something that you're doing routinely, it makes it so much easier, and that's the approach you've taken.
So this is normally implemented in daily relationship with the cat, and so the procedure is not only safe and effective, but it also feasible, which is extremely important.
Yeah. So I think we have one more. Exactly, this is a slide.
Which is a transformational approach to managing allergies to cat as part of a comprehensive allergy management plan, and then help reduce cat allergies while keeping your beloved cat in your home.
Again, all cats are equal, but some cats are more equal than others, and it's extremely important for the families to keep this big cat at home. I thank both of you very much for all your contributions. We have one more slide because there is important information that in this journal, Allergy, you can find an article which really summarizes what we know about this approach, which can really change the life of patients with cat's allergy. I presume you may have some questions from the audience. Yes, I just received the iPad, so I do have some questions. Okay, this is the first question. Is the efficacy the same for all breeds of cat?
Great question. The efficacy is going to be based on the amount of the allergens produced. All cats produce allergens, so you'll have, the efficacy is going to remain the same for all the cats.
Excellent. I have another question.
breed-specific
We are speaking
differences.
all the time about the cats. What about dogs? Because this is also one of the major problems. So can you comment on dogs?
Dogs is so that's the other common household pet. Dogs also produce allergens. There are slight differences between dogs and cats. One of the unique thing about the approach for cats that really worked is that it is one allergen that's the most prevalent or the most attributed to human allergies, and it is produced in the saliva. So it's a great way for us to be able to deliver the intervention because the antibody binds to the protein that is produced in the saliva. With dogs, there are multiple allergens, just like in cats, but there is not one that has such a huge, overwhelming coverage in terms of human symptoms. The other challenge with dogs also is that most of these allergens are also produced equally in the hair. And depending on the size of these decks, some of that can be huge. So an approach like this, in principle, could be work, but we have to adapt it to the unique needs, and those are some discussions and things that we're working on.
I have another question for, I don't know which one of you want to answer. In the home environment, how long would it take to be effective, as the FLD1 remains in the environment for some time?
Yes, we have some studies showing that you can still measure FLD1 after years from the cat being relinquished. So this is important to understand. So feeding the cat with the anti-IgY should be implemented with the combining measure of washing carpets, washing floor, washing walls, and then to continue to feed the cat with the antibodies. The point is, I guess, 3 weeks for the cat to have this neutralization, correct?
Yes. So it typically takes about 3 weeks, but all the studies, as you rightly pointed out, we measured saliva in the cat, we measured hair on the cat. The environmental measurements is going to be impacted not by what is being delivered into the environment, how much of that is reduced or removed by the cleaning and the other protocols. The nice thing is that many people who have these challenges tend to have these protocols already worked into their routines. So it kind of normally flows through with what happens. And in some of the feedback that we've received with the product on the market is that they're starting to see efficacy roughly in the time frame that we've seen with some of these studies. And that, I think, alludes to the fact that they also have a cleaning routine that goes with that.
Excellent. I understand there is a question from the audience. Yeah, okay. Yes, sure. Please. We do not hear you. Well, but I'm sure the technicians will help us.
Thank you. Oh, okay. I'm just too short. I'm Laura Haya from Canada. Congratulations on this really innovative approach to cat allergy. It's very interesting. I'm wondering, you've done a lot of studies with the cats and some clinical studies to show the efficacy of the symptom reduction in humans. Has there been any look at the safety of the modified FLD1, the neutralized FLD1 on humans? I know it's now a slightly different molecule, but it will be, inhaled and presumably ingested by people.
It's a great question. We have not looked at the effects of the combined complex, if you want to call it, on humans. But again, it's a question that perhaps could be investigated. But if you look at the history of egg antibodies, they've been used for all kinds of things in diets, raised against various proteins added as part of our diets. We probably, if you have some products that have spray-dried egg yolk, you already have that. So in terms of because of its long use, the safety issues with those are very, very limited. So it's a great question, something worth to be explored. But if you look at, if I'm a betting man in terms of risk, the risks are going to be very minimal. And the other important point that you also bring up is we're not modifying the complex, we're not modifying the protein. It is bound. As it gets dried, I'm assuming it all breaks apart like any protein in the environment would do. Thank you.
Thank you.
And if I can add a comment, when you had the human proof of concept study, when they feed the cat, some small proteins can be inhaled, and you had on the other side the reduction of symptoms. So
we had no issues with any other participants. That's a
and other
great
questions
point.
from the audience.
Thank you very much. Pete Smith, Australia. Thank you for a lovely talk, and it's an exciting topic to bring our pets closer. You mentioned the talk, the priming effect. Now, Connell, 1967, described the priming effect with seasonal allergy. With greater exposure, we become more reactive. He then followed it up in 68. You become real reactive to that allergen, but also other allergens and irritant sensitivities. So in dropping the level lower, are you reducing your stack that you may be less sensitive to both other IgE sensitivities, such as dust mite, or irritant triggers, such as smoke, perfume? I'm just asking.
That's a great question. And again, I think we actually came across that issue when we started this human proof of concept study. The patients that we recruited for the study, one of the conditions or to be part of the study was they should not have a cat in the household. So most of these were diagnosed with cat allergies earlier on, no longer had an association with the cat, and therefore when you came into the study for their first test, unless you give them a huge bolus exposure, they don't seem to have any symptoms. So what we did was to expose them on the first visit, let them go home for a week, come back, and then the actual study started. But that's a great point. As part of the protocol, we were only approved to be able to only test for FeLD1 or FeLD4. We never had the chance of doing anything else, and that's something we can look back if you have the samples.
Okay, thanks a lot. We don't have any questions from the participants online, and we don't have a question, but I do have for both of you. Let me tell, you have the option to do the clinical trial now. What would be the best study design that you, at the next step?
It's something that we have pondered long and hard, because I think that'll be kind of the next evolution of the project. And again, I'm not a human allergist. I'm an immunologist. You know, I look up to you as experts in the field to guide. The feedback that we've gotten is that given the environmental component, it has to be highly powered to be able to see the efficacy. And when I talk about power as a scientist, it obviously reflects in terms of the budget that's involved around that. So those are some discussions that are ongoing. We have not come to a resolution on that, but it has to be significantly powered in terms of taking into account, as well as try to control as many variables. You brought up a good point. Cat produces allergens and releases into the environment. A lot of factors influence how much remains, how clean your household is, what's the cleaning protocol, what's your exposure level, how big is your household. So to be able to control for that, I think, is really the challenge if you venture into that area.
Antonella, from your point of view, from a clinical
From my point of view, I already proposed a clinical trial to him, and then I would like to have a clinical trial in children, both for prevention and for treatment.
management.
And yes, and then this would be really a breakthrough as you not only treat the child, preventing comorbidities and chronic evolution of the disease, but also you may try to prevent when the child is born, that you can start to feed the cat with the anti-IgY. We have experience with this for the house dust mite allergy. So we can combine our different expertise in a multidisciplinary approach and find the best solution for the benefit of our patient.
So this discussion shows that, again, as Bernard said, science never solves a problem without creating 10 more.
Other questions?
And it's
Yes.
very true for the topic we are
Yeah.
discussing today. You solve one problem and immediately you have 10 others to be solved, which makes science so fascinating because eventually there's always something to be studied.
And us
We don't
very
have more questions.
curious to address these challenges.
Exactly, that's also true. Okay, we don't have more questions from the audience here and from the audience who joins us virtually, so allow me to summarize some take-home messages. Cat allergies affect as many as 1 in 5 adults,
Yeah.
probably also many children. Cat allergies can have detrimental effects on quality of life and productivity,
Yeah.
that's for sure. And in addition to the classical care pathway in the management of cat allergy, which we discussed and you started with your patient, we have this innovative approach which is now available, making it possible to keep a cat at home of allergic patients. And again, allow me to repeat, science never solves a problem without creating 10 more.
And
we do have a lot of issues to be discussed and hopefully to meet again. With this, I would like to thank both of you for participating, those of you who joined us here in the auditorium, and also everyone who joined us virtually. And again, congratulations to the Purina Institute, and we hope to hear and see you very soon. Thanks a lot. Thank you very much.
Thank you.
Thank you.
Thank you.